Hello and welcome to another episode of Let's Talk Health. Today's session will be on treatment on knee arthritis, and to discuss this we have with us Dr. Sridhar Mustiala, Senior Consultant Orthopedic Surgeon at Citizens Hospital, Hyderabad. So good evening, Doctor. So before we start with the questions, I request you to give a glimpse on your expertise to our viewers.
Hello all, I'm Dr. Sridhar Mustiana, FRCS Trauma and Orthopedics. I'm a senior consultant at Citizens Specialty Hospital. I specialize in hip and knee replacements and arthroscopy of the shoulder and knee, and I also evaluate sports injuries and other treatments about sports injuries, which does not involve surgical management as well.
The first question for you today is, what is arthritis and what are its types?
Yeah, arthritis is a generalized term where it means basically wear and tear of any joint. Coming to the knee joint, which is our topic of interest for today, knee joint is made up of mainly three bones. That is the thigh bone, the femur, the leg bone or the tibia, and the kneecap, the patella. So normally there is something called cartilage, which is like a cushion between the bones where the bones glide on each other, forming a very congruent and smooth articulation. When there is incongruency because of any reasons where the cartilage is worn off or it becomes irregular, then it is called arthritis.
So coming to the next question, sir. What are the causes of arthritis?
The causes of arthritis are many. In most cases, it is idiopathic. That means we don't know the cause. But the most common contributing factors for arthritis, coming to the knee joint, first is weight. People who are overweight or obese tend to develop arthritis much earlier in life because the amount of stresses or weight that falls on the knee joint when we are walking, especially when we are doing the stairs, is about 4 to 5 times our body weight. So you can imagine the amount of stress that falls on the kneecap and the knee joint when somebody is obese. The next most important is muscle weakness. There are a lot of muscles around the knee, especially the quadriceps muscle, which is the muscle, the big bulky muscle in front of the thigh. In people whom the quadriceps is weak, then the amount of strain fallen on the bones also is very high and they tend to develop arthritis earlier. The other causes are various factors where the congruency of the joint is lost. It could be because of badly aligned bones or badly aligned ankle, which causes the change in axis of the knee joint, or any previous injuries to the knee joint which have been treated with plaster or surgery, where the congruency of the joint surface is lost, they can develop arthritis. This we are talking about osteoarthritis. Then there is other arthritis which is called rheumatoid arthritis or inflammatory arthritis, where people who have rheumatoid arthritis, they tend to develop arthritis much earlier because the cartilage is damaged because of the inflammatory process.
Next question is, sir, what can you do to prevent or stop arthritis?
As I said for the previous question, people who are obese tend to develop arthritis earlier. So for the idiopathic causes, obviously there is not much we can do. But for the known causes, there are a lot of things a patient or anybody can do to prevent arthritis. First is managing weight. So you need to work on trying to manage a ideal weight. Then the next is strengthening the muscles around the knee joint, mainly the quadriceps. So regular quadriceps strengthening exercises will help. And then again, maintaining general bone and muscle health in terms of vitamin D and calcium supplementation and B12 supplementation for muscle health.
Is surgery required in all cases? Any medical managements?
Surgery is not required in all cases. In the early stages, it can be managed medically. Sometimes the pain is because of some inflammation in the cartilage or the muscle around the joint or the ligament. So sometimes anti-inflammatory tablets can help. And again, as I said, strengthening of the quadriceps muscle will help. And if there is any malalignment in the foot or the knee, some minor adjustments of the alignment can help or reduce the amount of stress falling on the knee joint and can help knee pain. Then there are other measures which we can do to temporarily help the knee pain in the terms of some injections into the knee joint.
What are your thoughts about the stem cell therapy?
Yeah, good question you asked. Nowadays, lot of hullabaloo is going in the social media about stem cell therapy, and in fact, it is probably being misused to a large extent. Basically, it is not stem cell, but it is called platelet-rich plasma therapy or PRP therapy, where they draw your blood uh, and then centrifuge it so that the platelets are concentrated, and these platelets are injected into the knee joint. Though many people are using it for all stages of arthritis, long-time studies have shown that it is not more than a placebo effect or a minor relief of pain because of the anti-inflammatory action. So in very, very early stage of arthritis, maybe it has got a role, but in the clinic setting where we see patients in the stage 3, stage 4 arthritis, I don't think it has any role in management of knee osteoarthritis where patient is already very symptomatic. Then there are other type of injections which is called BMAC, bone marrow aspirate concentrate, wherein blood is drawn from the bone marrow, usually the iliac crest, that is the bone near the hip joint, and this is again centrifuged and concentrated, and the mesenchymal stem cell from where the mesenchymal stem cells are injected into the knee joint. Again, there are different ways of doing it. Either you can inject it directly into the knee joint, or you can open the knee joint and make these cells in a fibrin or glue based and put it on the site of damage where the arthritis is very localized, or chondral injury, the cartilage injury is very localized. It is called bone marrow aspirate concentrate treatment.
Next question is, what exactly is total knee replacement?
As I said, when the arthritis is very severe, none of these injections or medical management doesn't help the pain. Then we have the option of what is called total knee replacement, where the lower end of the thigh bone and the upper end of the shin bone is cut, okay, and shaped using a specialized jigs, and where metal implants are cemented onto the lower end of the thigh bone and upper end of the tibial bone, and then there is a plastic insert in between where the joint smoothly glides. These usually implants are made up of titanium and cobalt chromium and highly linked, high density cross-linked polyethylene.
So coming to the last question for the day, sir, what are the risks associated with it?
Knee replacement is like any other surgery. It is a moderate surgery, so there are risks associated like with any other surgery. But with taking proper precautions, because this is not an emergency surgery, stabilizing and optimizing the patient, more than 95% of the patients are happy with their result. Like any other surgeries, there are risk of infection, malalignment, loosening in the long term, but we all take appropriate precautions to prevent infection in the terms of we operate total knee replacements in very high, clean, modular theatres and highly trained theatre staff. So the risk of infection in our setting is very, very low. And we use only high-grade implants, high-quality implants. So the risk of loosening and long-term longevity is very good.
So looking at the questions, doctor, there is one doubt, like, are there any injections in this medical management situation?
Yeah, we do, or I do inject into the knee joint sometimes. In cases of where the arthritis is mild to moderate, or where the patient doesn't want an immediate surgery, or she wants to postpone the need for surgery for a later time for various reasons, then there are some types of injections which can be given for temporary relief of pain. One of the most commonly used is with steroid injections. Basically, we inject steroid injection into the knee joint in very small quantities. This reduces the inflammation and the swelling in the knee joint and does help knee pain in most of the patients, though temporary. It could be from 3 months to 1 year, depending upon the amount of arthritis the patient has got. Then the next injection we have is called viscosupplementation. Basically, it is like a lubricant injection. Like lubricant elsewhere, where when there is friction, we use lubricant. We can use lubricant injections or viscosupplementation into the knee joint. Again, as I said, as with the steroid injection, these lubricant injections also temporarily do help in relief of pain. again varying from a few months sometimes to a year or so, depending upon the amount of arthritis.
So thank you, doctor, for your valuable time and inputs. So with this, we conclude today's session on Let's Talk Health. We'll be back next week. Till then, take care, be safe.